You may have heard about leptospirosis before and want to know more about it now. That is what I'm here for. I am Jalaya Ashley, a BSN2 student who will discuss to you about leptospirosis, its overall description, risk factors, signs and symptoms, treatment, prevention, and prognosis. So let's start by answering the question, what is leptospirosis? Well, leptospirosis is a bacterial infection caused by Leptospira. Such a disease can be acquired primarily from making contact with the urine from infected animals, which can also contaminate soil and water for weeks or even months. Leptospirosis transmission start with an animal infected with Leptospira. This animal can urinate on water, which can contaminate said water with the bacteria. If a human comes into contact with the contaminated water, then there is a huge possibility that they have contracted leptospirosis. After learning about how leptospirosis can be transmitted, let's get to know about the risk factors that put one in a position where they are most susceptible. People most at risk are those that are constantly in contact with potentially contaminated water, such as farmers, sewage workers, and miners. If you have leptospirosis, then there are signs and symptoms that are expected to be observed. Some include high fever, red eyes, tummy pain, muscle pain, and headaches. Other symptoms of leptospirosis also include rashes, vomiting, jaundice, and diarrhea. You should know that if leptospirosis is not treated as soon as possible, then it may cause severe kidney, brain, and liver damage. It would be best to immediately consult your physician or go to the nearest health facility when fever of more than 2 days is observed. So now it is time to learn about the courses of treatment recommended when you may have contracted leptospirosis. First is the usage of antibiotics. Medical treatment of leptospirosis includes a course of antibiotics utilizing any of the following: doxycycline, amoxicillin, ampicillin, penicillin G, and ceftriaxone. The specific antibiotics are determined by your health practitioner. Second treatment involves mechanical ventilation. If the bacteria has infected your lungs, then you will have difficulty in breathing. A mechanical ventilator is a machine that will help breathe for you in these cases. Lastly, we have plasmapheresis. Your plasma will be separated from the blood. It will be replaced with another liquid to help you prevent organ damage caused by severe leptospirosis. As nurses, it is imperative that we apply nursing interventions to help our patients recover from this condition. Nursing interventions regarding leptospirosis primarily include the teaching of preventive measures to avoid contracting the disease. First, avoid swimming or wading in contaminated water because it may potentially have urine from animals infected with the bacteria, Leptospira. We should also teach our patients to use boots and gloves when your job truly requires you to make contact with potentially contaminated water most of the time. We tell our patients to make it a habit to properly segregate your garbage and to ensure that your surroundings are clean to prevent carriers of the bacteria. Furthermore, clean your wounds aseptically, as well as to always wash your hands with clean water and soap after making contact with potentially contaminated water. Lastly, we remind them to remember to hydrate yourself throughout the day by drinking 8 to 10 glasses of safe and clean drinking water. Prognosis. There is 90% chance of surviving mild form of leptospirosis since it is rarely fatal, usually recovering well after an antibiotic treatment. Without treatment, leptospirosis can lead to kidney damage, meningitis, and liver failure, with a mortality rate averaging approximately